what kind of screenings are we talking about now? I mean, there's a whole list of them.
That's right. So in particular, we're focusing on lung screening. So people that are at risk for COPD or chronic obstructive pulmonary disease, emphysema, people that have a history of smoking or over age 40 should consider coming in for a screening for COPD. It's estimated about half of the people with COPD are not diagnosed. The screening can be as simple. This is
look at that.
Handheld spirometer, but there's more complex ones that we have in the lab.
Probably more detailed, I guess. So how does this work?
You essentially just take a deep breath in, and then you blow out as hard as you can, and based on how much air you're able to blow and how quickly you're able to blow it out, we can tell things about the functioning of the lungs. Although this is a test for screening for COPD, people with symptoms such as shortness of breath or cough can also get these kinds of tests to evaluate for asthma or other lung diseases.
And you don't necessarily have to be a smoker to have this kind of disease, right?
To have COPD or emphysema, the most common risk factor is smoking, although air pollution and occupational exposures and some genetic factors can put you at risk.
Can you test me?
I can. It's going to take us a few clicks through.
Okay. And which hospital are you at?
I'm at Intermountain Medical Center, so I'm the director of the Schmidt Chest Clinic, and we specialize in all sorts of lung diseases.
And you guys are probably busy all the time, aren't you? And speaking of lung cancer, I don't know if you go that, if you're into it that much or not, but a lot of people seem to think that it's a smoker's disease or maybe hereditary, but lung cancer is no respecter of persons, I guess.
So the biggest risk factor for lung cancer is smoking, although up to 10 to 15% of people may have lung cancer with never being smokers.
Okay, so don't smoke. That's the main thing.
That is the main thing.
Okay, so I need to take the test here.
So I'm going to have you take a deep breath in and then put your lips around that, hold it, and then blow out as hard as you can. I'm going to tell you when to stop. Keep going, keep going, keep going, keep going, keep going, keep going. Keep going, keep going, keep going, keep going. All right, take a deep breath in. Okay, you're good. Okay.
Do I have any diseases?
Let's take a look.
Other than craziness. All right, we'll continue to calculate this, and we'll come back and give my results because we have to go.